Good evening to everyone out there watching tonight. Welcome to another episode of Veterans Voices. Today is February 19th, 2018. I'm Nathan Johnson, the Contra Costa County Veteran Service Officer, and I'm glad to be joined by my co-host, Kevin Graves.
Good evening, Nathan.
Good evening, Kevin.
The purpose of Veterans Voices is to explore the issues that matter most to the veterans community and connect veterans and their families with the benefits and resources that are available.
Tonight's episode is called Traumatic Brain Injury, An Invisible Wound. We're going to introduce you to veterans directly affected by the injuries resulting in TBI, as well as doctors who have the specialized experience in treating them. We'll also interview Chris Nowinski, a former professional wrestler, author, and co-founder of the Concussion Legacy Foundation.
If you're at home watching and want to join our discussion, please feel free to call us right now at 925-313-1170. Our phone lines are open, and we are excited to take your calls. You can also send us an email at veteransvoices@contracostatv.org or connect with us on Facebook at Veterans Voices 1.
Before beginning, we want to take a moment to recognize and honor the service of Edward Butler. Edward served in the Army for 20 years and deployed to Vietnam as an infantryman. Because of his courageous actions during an ambush while there, Edward was awarded the Purple Heart and an Army Commendation Medal with a V device for valor. Upon his retirement, he achieved his lifelong dream of becoming a deputy sheriff in his hometown. He now lives in Brentwood, California with his wife. Please join us as we recognize Edward's military service.
TBI, An Invisible Wound, is our topic this evening. I would like to welcome veterans Ryan Sykes and Melissa Margain to our show. Hi, you guys.
Good evening.
Melissa, it's good to see you again.
Absolutely.
Welcome back to the set.
Thank you. Always a pleasure.
Ryan, thanks so much for being here tonight. Really appreciate it.
Thank you very much.
So before we talk about traumatic brain injury, introduce yourselves. Tell us a little bit about your military service and a little bit about what brought you here tonight.
Sure. My name is Melissa Margain. I served in the United States Army from 2005 to 2013, initially as a dental specialist, and I ended my career doing dental forensics for the Southeast region, identifying soldier remains by dental records.
Okay, thank you.
My name is Ryan Sykes. I was in the Navy over about 8 or 9 years, and I served all over, mostly on the East Coast. And I moved my way over there, back over to California, back over to the West Coast after I got injured.
Okay, and thank you both for being here tonight.
Thank you.
Appreciate that. So tell us a little bit about how it was, the circumstances behind your TBI, if you want to share that with us, that'd be great.
Sure. In 2009 in Balad, Iraq, there were a group of soldiers. We were standing outside and just kind of functioning our normal day. And we heard the incoming siren, which is a lot different, as you know, than just kind of the normal, there's an attack. And once the blast went off, we realized that it had hit the generator attached to the building we were standing outside of. So a few of us, including myself, were thrown. I landed on my head during the injury, and so ended up getting diagnosed with the TBI, seizure disorder, and some bilateral knee injuries.
And Ryan, would you like to share a little bit about your circumstances?
Yeah, I was injured in 2008. I was on duty. I'm riding my motorcycle, and I crashed it. This was overseas in Afghanistan. And so while I was there, I had my traumatic brain injury, collapsed lung pneumonia, facial fractures, some soft tissue damage. And then I laid outside for about 5 hours. And then I was brought, once they medevaced me out, I was brought over eventually to the East Coast.
Was this a dirt bike or it wasn't a road bike of any sorts, right?
No, it was what we call a Haji Davidson.
Haji Davidson.
No, so it was kind of like a street bike, but kind of like a dirt bike.
Oh, okay. An enduro type.
Correct, yes,
Okay.
yes.
Yeah. Well, thank you for both sharing that. We really want to open up this discussion about traumatic brain injury. We've never talked about it on our show before. And in a sense, it's kind of an invisible injury for some people. You could look at a person and see that they look completely healthy. They're not missing any limbs and such until you really discover how that person's been affected by a brain injury of sorts. So these are both combat-related types of injuries, and of course, traumatic brain injury affects people in the community, and other types of injuries, car accidents, and football injuries and such. And I want to again invite our audience to participate in this discussion with us. We have two veterans on the set here who will talk about how traumatic brain injury has affected them in their lives, but we want your questions, your comments, and we want your participation in this conversation. So after sharing a little bit about the details of how the injury occurred, how did it immediately affect you? And any way that you noticed a change in either the physical change in your body or maybe the cognitive change in your body at all?
So for me, mine wasn't immediate. Once I returned back stateside, I started noticing, some memory loss. Every now and then I'd have staring spells. And so actually went through really a long history of just different diagnoses. It went from absence seizures to, not really sure, to all these different things until we finally were able to kind of narrow it down. But I went through speech therapy, cognitive therapies, did functional MRIs, and just, tried to hone it in on what were my triggers. So it, presented for me a little late, and obviously different than Ryan, so.
Mine was fairly significant, obviously. My recovery started basically when I regained consciousness back in the hospital. I'd already been there for about several weeks before I came to. And then once long that I had speech therapy and all the different physical therapy and whatever the other therapies associated with it. And I'd gone to Omaha, Nebraska for full-on treatment, basically to learn everything all over again, because I'd pretty much forgot how, or didn't know how to do anything.
So extensive therapy of all kinds for you, Ryan, and you traveled to several different areas in the States to get that specialized therapy. True? Is that true?
Yes, sir. Yeah, I did. My initial treatment there at the hospital, and then I went over to Omaha, Nebraska, and did some outpatient therapy. And I had done more therapy, hyperbaric oxygen therapy in Salt Lake City, Utah. And I'd done some of my own therapy in Texas when I moved there.
I want to talk more about this, but we do have a caller. We have William from Sacramento. William, are you on the line with us?
Yes, sir. How are you doing today?
William,
how are you? Good
thanks
to
for
hear from
joining us. And how can we help you, sir?
Well, you said you wanted to hear veteran stories about people who've had TBIs over in combat?
Absolutely, yes. Share your story.
So, in 2008, 2009, 2010, I was in the National Guard unit that was in Tikrit, and I was doing convoy security, and during that time, I suffered 8 traumatic brain injuries in a 16-month period.
Wow. Oh, my gosh.
And the thing of it is that I only had 2 that would be considered, anything combat type of related, but what happened was they were from accidents that we had driving the vehicles when there was explosions that happened near our vehicle. And so, but once you had one, then the next time anything happened to your head, anything hit your head, then you had another. We were doing combatives class, and I got flipped on my back, smacked my head, another concussion. Then we're moving around, and someone hits you on the head, on an accident with something, another concussion. And what happens is, I don't know if you understand a lot about concussion protocol, why the NFL has it so far, but in the Army at the time, especially in the National Guard, once you get one major concussion, one upon another, they become so easy and they become more intense every single time.
Yeah.
Well, we appreciate that. That there is that compounding effect that I don't know if people are aware of, and I think you just become more susceptible. Is that correct?
Yeah, literally by the end of my tour, I didn't realize how bad it was. All I knew is that I was having major headaches, major concussions all the time. I was having gaps in memory. I was having issues with my bowels where all of a sudden I lost the ability to tell, how you can tell when you have to go to the bathroom, like anywhere from 10 to 20 minutes before, it would hit me immediately. And those are all signs of people who had major concussions. And one of the things, when I got to Fort Lewis after my deployment, that's when they did a brain scan, and they were like, oh, hey, by the way, you got a brain bleed. And from there, that's when I was able to get some chiropractic help, to get some other type of help, just to release the fluid buildup that happened in my head.
Well, William, thank you so much for joining us, and thank you for sharing your story. So this is another veteran who's been affected by a significant brain injury, and it sounds like in this instance, not necessarily combat related, but in a combat zone, but due to different types of vehicle accidents. I'm wondering what has been most helpful to either of you to help you recover from this injury and return yourself to a normal lifestyle?
I think a lot of it is involving yourself in community, socializing with people, something to get yourself back out there, bring normal activities like you're doing before. So kind of like you're not labeling yourself as somebody with traumatic brain injury sitting in the corner. You're out there doing your own thing.
That is absolutely awesome. That is awesome. And you've been living on your own independent living on your own now for how long, Ryan?
Oh, geez, probably about 7 years.
And that is just absolutely fantastic. Go ahead.
Oh, sorry if I may. It might be difficult at first. I remember changing the blades of my razor. It took me like 15 or 20 minutes.
Right.
So initially it'll be very frustrating, take a long time. But over time, you get the hang of things, become easier. So little by little, you ride yourself, just like walking upstairs, higher and higher.
Right.
That's fantastic. Right. And Melissa, you have a family, so there's an effect that occurs, between a mother and her children, and it can be a little different. How has that been for you?
It was difficult, especially coming back with my oldest, who's here tonight. I was extremely disconnected. I had kind of become emotionally unavailable, especially when you're in a combat zone, and so having to come back and kind of reunify with the family, and you don't know how. Not just from the deployment, but now I've got, added stress and added pressure. So it was really, really difficult. A lot of high anxiety nights and just, quick tempers. So definitely an adjustment.
What would you recommend? I'm sorry, I'm kind of fixing this stuff because I can't hear half the time. But what would you recommend to another veteran who might be thinking that a brain injury might be something that they had incurred? Ryan, yours is a little bit more obvious. So if there is a severe traumatic brain injury, what might you say to them to help push them through? Or Melissa, you mentioned yours is more of a mild, or it wasn't one that was obvious right away. It was something that. So what would you recommend to a veteran who's starting to think that I may have this injury, or who knows they have the injury and might be thinking how they could push through? How would you help them?
Pay attention to your body. Okay. Nobody knows you better than you. If something seems off, if, like the caller stated earlier, you start to notice lapse in memory or, other physiological changes, better safe than sorry. Definitely get out there and get yourself checked.
Anything you want to add to that, Ryan?
Yeah, like Melissa's saying, you have to be honest with yourself and come to grips with what's, the reality of the situation, and then be humble enough to accept help and not work on what you need to work on to correct or fix everything to bring yourself where you need to be, want to be.
That is fantastic. Well said, both of you. I want to thank you for being here with us tonight and for having the courage to come and share your experiences with other veterans. We want to thank our phone caller for William for talking to us about the cumulative effect of TBI. And at this point, we want to thank you for being here, and we will move on to our
Please stay tuned. Please stay with us. We'll be right back after this quick message from the Contra Costa County Veterans Service Office. Hi, I'm Nathan Johnson, Contra Costa County Veterans Service Officer, and I'm joined by Veteran Service Representative Buck Carmichael. So Buck, when a veteran comes into our office, what benefits should they apply for?
Well, Nathan, we have a series of benefits that we go over with the veteran when they come into the office. The first one is disability compensation. Compensation is when the VA recognizes a service-connected disability. There's also another program called pension, when the veteran is a wartime service veteran with limited income. There are other services provided by the VA, such as education benefits, home loan guarantees, survivor benefits, insurance, and finally burial benefits for the veteran and the spouse.
So please visit our office and let us help you apply for these very important benefits. Thank you.
Welcome back. And now we'd like to welcome two individuals who are experts in TBI, Dr. Jim Muir and Dr. Andy Kaiser, to the show. Welcome, guys.
It's great to be here.
Boy, we're excited to have you here. We want to hear a little bit about your experiences and what you've done to help treat and explain to individuals what's going on in their head.
Say a little bit first maybe about where you work and the work that you do. How are you involved in helping veterans with traumatic brain injury?
Sure. Well, I'm a neurologist at the VA here in Martinez. I've been here for about 10 years, work closely with Dr. Muir. And I have a traumatic brain injury clinic as well as a general neurology clinic. And we focus on, at least on my end, on trying to understand whether a veteran's symptoms are due to traumatic brain injury or to something else or to a combination of symptoms, which is often the case.
Okay.
And I'm a neuropsychologist, and that's a psychologist who also has interest in the functioning of the brain, just like Dr. Kaiser. And I really enjoy working with the veteran population. I like it because it blends a whole lot of different areas of psychology. So, we need to know about the function of brains, but we also need to be able to handle anything else that our veterans bring to us. And so that means sleep disruption. Oftentimes that means substances, either prescribed or unprescribed. It means mood, anxiety, depression, post-traumatic stress disorder, and anger issues, which are pretty common after a brain injury. So we get to kind of work with all these things. It makes.
And you work exclusively with veteran populations, or do you work outside and with other types of traumatic brain injuries as well?
I personally just work with veterans clinically. I have a research focus as well, but that's not necessarily veteran related.
So how do veterans come to you? I know the process of a referral and such, but do veterans typically come to you on their own individually, hand up, hey, I think something's going on here? Is it a spouse who's kind of pointing the finger? Or maybe does a doctor pick up on this, maybe during a primary care visit?
All the above, really.
Okay.
Yeah, there are multiple routes for people to get to us. One of the things that the VA has done a pretty good job about is instituting what's called a TBI screen. So anyone who comes to the VA, whether it's to see a social worker or a primary care doctor or a nurse, is supposed to get this screen at some point. And that screen, if they answer yes to one of the questions, they get referred to a traumatic brain injury clinic.
What kind of questions is this screening asking?
Typically something like, have you been exposed to a blast? Have you have you hit your head on something or been struck in your head by something? And then they'll ask you about symptoms that were associated. Did you lose consciousness? Did you feel dizzy? Did you get a headache? And generally speaking, if you answer yes to one of those questions, they're specifically about symptoms.
So losing consciousness is not specifically a requirement of a traumatic brain injury then?
It's a great question. Absolutely not. No, what's required for the definition of a traumatic brain injury is just that you've had an alteration in your neurological function that's a result of a blast or hitting your head or being hit in the head by something. And so that's a pretty broad definition. And
Dr. Muir, you've mentioned the fact that there's it can be a combination, you deal with a combination of different symptoms from different causes. They don't necessarily all root from TBI, but they seem to be coexisting or all part of their service in the military, typically?
All part of the service in the military, typically. Although sometimes things come from other places, but it's often sometimes quite difficult to tell what's the cause of the symptoms, right? If you look at the list of symptoms for mild traumatic brain injury, it looks pretty similar to the list of symptoms for post-traumatic stress disorder. Right. And so early on, we were investing a lot of energy into trying to tease out, is it 40% this or 60% that? And these days we're recognizing that these treatments that we're developing actually work really well, regardless of the cause sometimes, or they work really well if there's a multitude of causes working together. So these days, we just get down to business and start treatment.
And that's fantastic. It's rather than spend time trying to figure it all out, let's just treat the symptoms as a whole and try to make that person whole again.
That's our approach these days.
That's very good.
So just to pause the conversation, again, I want to just invite our audience to participate. We're talking about traumatic brain injury tonight, and we have on stage with us a few experts who help veterans who have incurred a traumatic brain injury. You may be familiar with how serving in the military can result in certain type of traumatic injuries. You may be familiar with veterans who lose limbs, but traumatic brain injury is an injury that's often not seen. It's an invisible wound. So this is an important conversation. We'd love to have your questions or your comments. If you're on Facebook Live joining us or over CCTV, call in. We'll take your questions now. What is the best way that we can help veterans who have incurred a traumatic brain injury? Is it a combination of any sorts? Is it a specific medicine that can be treated with something like surgery?
So typically surgery isn't something that's involved unless it's in the acute stage. So Ryan had spoken earlier about his traumatic brain injury, and surgery may have been important there, but typically in the chronic phase it's not something that's considered. So the treatments, Dr. Muir can speak to this as well, but very often it's managing what we fancy word, comorbidities, the other issues that are going on. So, again, as you get a sense, either from your own experience or from the veterans who spoke before, when these injuries happen, they're often in, to put it mildly, very stressful situations. And so treating post-traumatic stress symptoms, if they're present, treating trouble with sleep, if that's present, treating pain, because pain is distracting and can contribute to memory changes. So you often need to treat many things at once, but many of those things are readily treatable. You just need to focus on them. And the other thing, and I'll wrap up and let Dr. Muir say something, is that it's not always medications. Even for me as a neurologist, that some of the treatments, the best treatments, are physical, or certainly not medication-based. And that's one of the important things about seeing somebody.
Expound on that a little bit for us.
Sure.
When you say physical, help us understand a little bit.
Well, a lot of the treatments are not directly targeting the brain injury, but they're targeting things that might be making the brain injury worse. So, for example, majority of veterans that I work with have some sort of sleep problem. And if you know how bad you feel after a terrible night's sleep, imagine that night after night after night. It's going to make the brain injury worse. Right. So if we can treat the sleep, things get better. Another example, a lot of veterans come with anger issues, and that can be made worse by the brain injury. And if that's creating wreckage in your life, then that's a significant problem. So we can actually be really helpful by focusing on anger issues. And those are just two examples. There's plenty of things that people with brain injury diagnoses are struggling with, and we try to just kind of prioritize where we're going to get the most bang for our buck and start with that.
I know a lot of veterans that I'm familiar with who talk about their traumatic brain injury. They talk about headaches. They talk about recurring severe headaches, and it's a question of whether it's a migraine or not, but it just seems to be like it's debilitating. I know that the two of you are maybe involved either directly or indirectly with a residential traumatic brain injury treatment program. When do you make the decision in regards to a veteran crossing that threshold of requiring some residential care versus outpatient care? When do they need to come in and really get that more intensive type of treatment?
Well, each of those cases is individual. I think one of the common guideposts for that decision is that people aren't doing well in their daily life. That often it's a spouse or a friend who will say, I'm worried about them. Or it'll be, they're starting to have financial difficulties as a result of being poorly organized and having a lot of insomnia and not being able to focus when they're doing something. So when people really seem to be struggling on the outside, that's often when we'll consider it. And even then, it's not right for everybody. We'll have people come and take a tour of our facility and see what it's like. Again, the goal is to get veterans back out to the community, so we want to make sure that there's a plan for coming in and at least the rough outline of a plan for getting out again.
So we had William from Sacramento on the phone earlier, and would love to have your questions or comments. We're talking about the treatment of traumatic brain injury. Maybe you're a veteran and you've incurred a brain injury in your military service. If you're willing to share that story with us, we'd love to hear. If you've had some treatment, either at the VA or through the community, that you feel has been helpful in your recovery, we'd love to hear that as well, or any questions. Share a success story with us, if you may, respecting the patient's confidentiality. I've seen some veterans who have been through the polytrauma unit in Palo Alto just make incredible recoveries, go from not knowing their name to doing things like becoming American citizens and not being able to walk to riding bicycles for long distances. So help us understand how some veterans are able to return back to a normal functioning level after this treatment that you're able to provide for them.
That one, or?
Well, sure. I mean, we've had plenty of cases where one thing leads to another, and a person winds up in a sort of a downward spiral. And oftentimes our patients, when they come to our program, they're pretty isolated and disconnected, and they're sort of hit bottom in a bunch of different ways. And so we bring folks in and we start diagnosing the various conditions that are contributing, and we like to start treating those and also get the person busy, busy doing something. Oftentimes there's exercise involved. We're very interested in the connection between physical functioning and mental functions. So oftentimes our veterans will start with an exercise program. It's very common. And then we will start going out of the community and getting involved with things, kind of like Ryan was saying. I think that's really important. Oftentimes they get involved with volunteer activities. We can help ease them back into school. And then oftentimes, if school goes well, people wind up moving into a job. And in the meanwhile, they're repairing relations with family or with other folks that there's difficulty. And so so folks are back in the family, they're back in intact households, and they're working and they're productive.
Yeah. We have an email coming in that is a great question. What can a spouse do to encourage a veteran to see a doctor when they have TBI symptoms?
So that's a great question. It's obviously very individual. It depends on the veteran, and as a spouse, you probably know that veteran better than just about anyone else. So what motivates that person, what's important to them, and then often a little nudge, without being too big of a nudge, can be helpful. So making the appointment or helping with the appointment. So when people have TBI symptoms, they're often, as we've discussed, having some difficulty with organization. They're not able to plan ahead in the way that's going to be coherent and remembered and workable. So helping with planning, again, focusing on what's important to them, using that as motivation, and then maybe taking them to the appointment.
Being there for them and with them.
Yeah. So oftentimes, in getting through the irritability and anger that can sometimes stop those visits is important too. So it's usually a conversation that's best had over time. I wouldn't say that you're going to go from no consideration to, oh yes, I agree with that in 15 minutes.
Is there a stigma that goes along with it for the person that's maybe suffering with TBI, that you need to, a threshold you need to get over with regards to that stigma of having TBI or dealing with it or being afraid to deal with it in a public environment?
I mean, I think oftentimes there's stigma against anything that might be perceived as weakness or illness or sort of being broken. Oftentimes, I think sometimes there's stigma against needing to ask for help, right? And so people think that lots of times people think, well, there's nothing wrong with me, or I ought to be able to do this myself, and there's something wrong with me if I can't. And so we're really always trying to do outreach and let people know that there's resources available. Come on in and let's see what we might be able to do to help.
Yeah, I think you're absolutely right. I think, and I was thinking earlier about the role of the spouse. It may occur that the veteran doesn't really see the injury at all, right? The injury has occurred, but they had to continue on with the mission, whatever the mission was.
Right.
And so, it could be that their buddies picked up on it, but everyone is just a little bit different in their military service. So they get home and maybe the spouse recognizes it right away. and the veteran may still be in the mindset of just pushing through and getting to the end objective and not taking the time to really reflect on themselves. Another question here, will the VA treat TBI issues if it occurred after military service due to a sports accident?
Of course. I have a number of patients in my clinic who are treated for TBI or related symptoms that sustain their injuries after their service. One that I can think of even before his service.
I think that's a great question. Once you become eligible for VA health care and you're enrolled in the system and you're receiving care, the VA provides comprehensive health care. Right. It's not just a treat your service-connected injury only. I want to thank you both for being on here. We'll be right back, though, with some more discussion about traumatic brain injury. And we're going to take a short break. But before we do that, let's look at next month's show. In March, we will be sitting down with the Veterans Health Administration to put a face to the name, meet those responsible for caring for veterans, and get to know the employees and their perspectives on the work that they do. Next up is former professional wrestler Chris Nowinski's perspective on TBI and how this work and organization contributes to understanding the injury. We'll be right back with more discussion on traumatic brain injury.
Chris Nowinski, PhD, is co-founder and CEO of the Concussion Legacy Foundation, a nonprofit organization dedicated to solving the concussion and CTE crisis by advancing the study, treatment, and prevention of the effects of brain trauma in athletes, veterans, and other at-risk groups. Welcome, Chris.
Thanks for having me.
Thanks for being on the show today. I wanted to start by having you tell us, if you would, about your lived experience as it relates to concussive injury.
Sure. It doesn't start until I was in my early 20s, and I was wrestling for WWE, and I got kicked in the head by a guy named Bubba Ray Dudley in a match that gave me a throbbing headache, and I suddenly forgot how the rest of the match was supposed to go. Unfortunately, at that time, though, I didn't realize that those were signs of concussion, so I kept wrestling and lying about what I went through, sort of minimizing it, and continued to wrestle with a headache for 5 weeks until I developed REM behavior disorder. I developed sleepwalking. And at that point, I suddenly was honest and said, my head's been hurting for 5 weeks. I think I did something, and learned it was concussion, and I developed post-concussion syndrome, and I never really became the same. And even learned over time that when I learned what a concussion was, I'd been getting them throughout playing football at Harvard and earlier times in my wrestling career, and just considered that to be normal. Double vision, blacking out, sky changing colors. I didn't know any better.
So that's post-concussion syndrome, those symptoms?
Right. For me, it was headaches for years. The sleepwalking I had to take medication for a very long time and still don't sleep well. And then, I'm always reminded something's wrong with my brain, because whenever I work out really hard, I get nauseous and get a headache. And I'm talking, I can't get over 80% anymore. So there's some sort of permanent brain damage in my brain, but it's hard to know what exactly it is.
Yet you still went on and got a PhD, and now you're one of the nation's experts in CTE and TBI. So how did these events shape the work you do now?
Well, I couldn't believe, once I did learn what a concussion was, and met a lot of that through Dr. Robert Cantu, who's my co-founder of the Concussion Legacy Foundation. I feel like I was in on a secret. Suddenly I was like, oh, concussions do matter, and all of us athletes are out there banging our heads with no idea what the consequences can be. Somebody should try to change that. And Dr. Cantu encouraged me to try, with my modest platform I had as a WWE superstar, to try to raise awareness and say, hey, it doesn't have to be this way. It turns out we should take concussions seriously, and there might be long-term effects, and let's just educate everybody and give them better medical treatment. And so that's what started the idea, and became a book called Head Games Football's Concussion Crisis in 2006. But what was interesting about it wasn't just a simple issue of educating people. Turns out that there was a business we were coming up against, and really led by the NFL, which has now been well chronicled, that they were trying to bury the concussion issue and bury the issue of long-term symptoms, because it was a risk to their business. And so we were living through a big tobacco type of situation. And so it became suddenly much more interesting than just, passing out information. It became, okay, we're fighting for the survival of athletes and veterans and sports in general against people with interests that are more focused on the bottom line.
Right. And now to zoom into your personal experience, how did it affect you knowing that your professional wrestling career came to an end suddenly and unexpectedly because of this injury?
It was hard. It was a hard transition. I had visions of headlining WrestleMania and spending the next 10 years of my life, traveling the world with some of the most interesting people and putting on, putting smiles on faces, as they say. And it was all just sort of ripped from me. And I could have probably gotten past more easily the change in life had it not been for the daily pain. Living with constant headaches, living with all the things that come with a brain injury, and not wanting to be around people, not wanting to do anything. I wouldn't trade my mid-20s with just about anybody. They were rough, and I wouldn't want anyone else to go through that.
My husband, as you know, is a former Harvard football player as well, and he was telling me he came from a community where football was the main attraction. They all just focused on football, and he said, I got my bell rung, and I remember you just have all the fans watching, and you can't take a knee or go out of the game. So I
Right.
hear that, and as someone who specializes in working with veterans, I think about how that would be in the combat theater when you're dealing with life or death stakes, and the odds of getting treatment or getting evacuated to really deal with what's going on are slim to none. So we hear about concussive injuries for athletes and veterans in the news. What are the similarities and differences between how TBI occurs and has an impact across these two groups?
So some of the important similarities, involve, we know they happen in sports. They happen from collisions or falls. In military service, we think of injuries in theater, blast injuries, but the data says really most of the injuries are happening not in theater, but in training, in motor vehicle accidents. But the reality is, when you serve, there's a good chance you could suffer a concussion. And in how you suffer it will sort of determine the odds of you actually getting diagnosed. Sports and the military share that culture that you don't want to let your teammates down, you don't want to let the people around you down. And so neither group has an incentive to raise their hand in the middle of a battle or in the middle of a training and say, I'm concussed, I deserve to go sit there and sleep on that bed while you guys continue this battle. Mm-hmm. And so part of the education that needs to be the same in both groups and that we focus on is that with athletes, we try to tell them, you're not going to help your team if you're out there playing with a concussion. You're going to be slower, you're going to have reaction time issues, and you could lose the game. Mm-hmm. And I don't know if that message is penetrated as much into the military, that I'm not there, but the idea that the stakes are even higher there when you're hurt, to actually take care of yourself, because by taking care of yourself, you're taking care of everybody else. You don't want to be out with a loaded gun or driving a car with people counting on you when your brain's not 100%.
Right. Yeah, I think that's well put. What can you tell us about innovative interventions that are going to be coming down the pike here for those who have had TBIs?
Well, unfortunately, the brain is hard to fix. And so what's exciting is that because of the increased attention, there's way more investment in therapies and treatments. Right now, there's about 5 things that have medical evidence to get you better when you have sort of post-concussion syndrome, modest brain injury, including lots of types of rehabilitation, visual rehabilitation, balance, physical therapy, because a lot of times the chronic pain from a head injury can often be due to neck or other soft tissue issues. So you want to be an active patient when you've had a brain injury of any sort, because the doctors can't tell by looking at you and often by testing you what's going to work. Mm-hmm. As science moves forward, we're going to get better at diagnosing what's your unique problem. What part of your brain is actually hurt worse than the others? What do you need to compensate on? Do you need certain cognitive therapies? Do you need other other support that is part of your brain overactive that's causing anxiety, or I mean, there's so much that could go wrong that we have a lot of work ahead of us to find out how to fix each symptom that can be caused. But the days are coming where we actually have objective measures of what's wrong with your brain, and then we'll have better measures for how do we treat it, and potentially even drug therapies.
And someone who's been through this with lived experience has a unique perspective on this, as well as your professional expertise. What do you think are some of the major myths and misperceptions that people have about TBIs?
There's a wide range. There's the conservative end where people think you don't have a brain injury unless you're knocked unconscious for a significant period of time. There's the other end of the spectrum that with all this work on CTE, people are worried one concussion and I'm going to develop CTE, which the evidence says is not the case. The peers need to, for it to have any sort of risk that we've seen, you need to have a lot of hits to your head, potentially hundreds or thousands over a period of time. So, one of the other myths and one of the other hopeful messages is that, the damage that you do is not necessarily permanent. And someone who sort of keeps getting a little bit better every year for the last 15 years, you will make incremental gains over time. And it's important to keep hope because your brain will always learn to compensate for the problems that have been created. And so it's a magical enterprise. And so, have faith that better days are ahead and that your recovery will continue to evolve over time.
Well, thank you, Chris. Any last thoughts before we let you get back to apparently the paradise-like setting you're in right now?
It's always nice to come visit your in-laws with your wife. I encourage that. Family is very important. But no, as a parting message, you only have one brain. Take care of it. And if you're like me and you've damaged it, don't lose hope. Keep fighting the good fight. Be an active patient. Believe that better days are ahead. And we're out here at the Concussion Legacy Foundation, not always sitting outside relaxing, but working hard to develop advanced science and develop therapies that can help.
Thank you for the work you're doing, and thank you for joining us today. Chris Nowinski.
My pleasure. Thank you.
I would like to thank Dr. Springer and Chris for the very informative interview. We are talking about traumatic brain injury. We are taking your phone calls, emails, or Facebook messages right now and would love to hear from you. In fact, we have an email right here in front of us now that says, does the VA work with doctors from professional sports to share info on TBI treatments?
So where the crosstalk is happening most is probably with universities. So because VA investigators, researchers often have, or typically have university appointments, they can work with the universities directly and all the athletes in college. So for example, the Pac-12 has dedicated about $3 million annually to research projects in TBI or related fields. And that is a clear area of overlap for both VA and UC investigators.
And what are we learning from that research?
It's early days, but it spans a range from so what we call basic science research, just trying to understand the mechanisms of traumatic brain injury, to clinical research, where we're trying to understand the effects of TBI in individual patients and use MRI scans or other measures to get some sense for how recovery proceeds in athletes.
And I was wondering, Chris talked about how there's similarities between combat and non-combat type of traumatic brain injuries. It seems that traumatic brain injuries either occur from a specific type of head trauma, a head hitting something, the motor vehicle accident, hitting the door, hitting the dash kind of thing. Is there any differences in the research? Does research show any differences between those types of, blunt force types of injuries and more of a concussive, more of the blast, kind of moving through the body and moving the organs, moving the brain around? Any differences between those types of injuries?
So from a biophysical standpoint, we suspect that's true. The data aren't definitive yet. But with a traumatic injury, so a blunt trauma sort of injury, then you can look to see where did the where did the impact happen? And you often see what's called a contra-coup injury, an injury on the opposite side of the brain as the brain moves within the skull. In contrast with blast, we think that may be more diffuse, that the pressure change can affect the brain more widely, but maybe not quite as severely. It's still an active area of research. It's a great question.
And we only have a couple minutes left, but if a veteran who feels they were experiencing issues with TBI, if they wanted to be involved in a research project, how would they go about that, and what kind of a commitment is that?
Right.
So it depends on the research study. So one way is to let your VA provider know. So there are ongoing VA studies that advertise. The advertisements vary. Some are just on the VA campus, others are through doctors, others are broadcast to the community. And the commitment varies. People can do as little as provide a saliva sample in one visit or participate in a cognitive rehabilitation study that consists of 12 visits over 12 weeks.
Well, Dr. Muir, Dr. Kaiser, I want to thank you both for participating in this conversation with us. We've covered a very important topic, traumatic brain injury, something we've never talked about before. So thank you both for being here tonight. And I want to thank our audience as well for participating in the conversation. We've had some great questions, and we hope you've enjoyed this topic. Next up, Steve Burchick had a chance to sit down with retired Major General Dan Helix for our segment, A Veteran's Voice. Please stay tuned to hear about how this former mayor of Concord, California, and Korean War veteran has dealt with PTSD through poetry and writing after coming home.
I'm Steve Burchick with Veterans Voices, and we're here today with retired Army Major General Dan Helix, who also had a long career as mayor of Concord, California. He is also the author of the Kochi Maru Affair. Welcome, Dan.
Thank you. Thanks, Stephen. It's good to be here.
When did you join the Army, and what were the circumstances?
I joined January 12th, 1948 at the Presidio of San Francisco. I'd finished high school, and my boxing coach, who had been in World War I, thought that I might enjoy Army life, and also the GI Bill. My family was very poor, couldn't afford to go to school, and so I joined at the urging of my boxing coach, but it was to get the GI Bill so I could afford to go to school.
What was the most memorable incident during your tour in Korea?
You know, you asked me that question, Stephen, and it was really funny because my first reaction was, as I thought about what had happened, the most memorable situation was when I knew that I was going home and walking off the hill and wondering if a sniper was going to get me or something, because I had finished my tour and I was on a way back to the world. And that really, I think, was probably, there were other experiences, some humorous, some sad, but the most memorable was that I had survived and I was going home.
We're glad you made it back, sir. You and I had talked prior to the show, and you mentioned that you have been affected by PTSD.
Yes.
When did you first realize you had symptoms?
I knew when I came home that I was not the same person who went to war. I had developed a bad temper. I was impatient. I had low tolerance for things that before had not troubled me. And I found that, for example, at Cal, I got into an argument with a fellow, and instead of resolving it, I resorted to, I clipped him one. And I thought, you know, why did I do that? And I realized that that I had changed. But ironically, what really brought it about, I'd been wounded a couple of times in Korea. So the VA had called me for to have my wounds checked. And one of the stops on this checklist, on this form they gave me, was at a place that where I walked in and I wasn't sure why I was there. And it was a large room, and there was a desk and a chair. And I looked around, and the fellow motioned, you know, come on in. So I came in, and he pointed to the chair, and I sat down. And he said, do you know why you're here? I said, no. He had a handheld mic, and he started talking into this mic. And he talked for about a minute. And I said to him, what are you saying? I gave you a one-word answer, no. And then he said, he wants to know what, and I said, enough of this BS. And I got up and I started after him. And he said, stop. He said, I'm sorry. I'm just doing my job. I said, what the hell is your job? He said, I know your record. He said, I'm supposed to talk to you. He said, you got a boiling point of 0. He said, you have to control that. You're going to hurt someone. I said, so? He said, that's my job. I said, that's the way you do your job? I got up and walked out. But I thought about it. And I thought, he's right. And I recognized that I was very impatient. And someone said something. He said, you know, it's like being born again. And he said, it's like in the Bible, you have to be born again. And I thought about that and realized that I needed to concentrate on changing my attitude. So I'd like to say that I got counseling, but I kind of figured out that the way I was going was the wrong way. And really, that's how I recognized that I had PTSD and that I had to be aware of it and treat people different, just be different.
On another subject, in addition to your novel, I understand you've written some poetry. It sounds like you're quite a writer, you seem to enjoy it. Would you be able to share one of your poems with us?
Yes, I did bring one poem. I feel that I'm learning how to write, but I did bring one because it's something, I was, again, thinking about the PTSD problem. So there is a short poem, a couple of verses on PTSD. Tethered, the brotherhood of war, angry metal sounds, kite's tail whipping, ripping, tearing, scarlet rainbows arching, panic, anger, shock, fear, survivor's guilt, depression, never fully expurgated, somnolent, awake in post-combat fog, sensitivity, creating gray shadows, fraught with anxiety, descent into madness, equilibrium distorted, hanging in time, space, blank check signed and cashed.
Thank you for sharing that.
Sure.
Finally, last question is, what would your advice to be to other veterans who are considering writing about their military experience?
Oh, I would encourage it. You know, I think one of the things that will help veterans, you cherish the time when you can be by yourself and put your thoughts down in writing. For me, the purpose of writing was, as I said earlier, to exorcise the demons. I found it really helped me to get a lot of the anger down on paper. So write about it. But I also would say to the veterans, I don't know why this is, but it always, maybe it's because they're closer. But the spouses have a tremendous impact. And if there's difficulties, it can become it can become increased significantly. I was going to say exacerbated. I never used that word before I was a general.
Okay. Use more clear, direct terms.
But it does apply. So recognize that your loved ones do love you, and they want you to be like you were, and you're not, but you can get pretty close.
Sounds like good advice.
Thank
Dan,
you.
it's been great chatting with you, and thank you
Stephen.
for coming to Veterans Voices.
You bet.
The VA Northern California Neuropsychology Service operates both neuropsychological assessment services and neurocognitive rehabilitation interventions. If you experience TBI symptoms, please consider making an appointment by calling the call center at 1-800-382-VETS. As the TBI Pathway of Care Manager within the military health system, the Defense and Veterans Brain Injury Center promotes state-of-the-science care from point of injury to reintegration for service members, veterans, and their families. Learn more at dvbic.dcoe.mil. The Concussion Legacy Foundation is dedicated to advancing the study, treatment, and prevention of the effects of brain trauma in athletes and other at-risk groups. To connect with them, call 857-244-0810 or visit concussionfoundation.org.
Are you a veteran who would like an opportunity for your voice to be heard? Do you have poetry, a story, or a piece of art that you want to share with the world? If so, our program wants to support you in this process by inviting you onto our A Veteran's Voice segment. Please connect with our show by emailing veteransvoices@contracostatv.org with details about what you would like to do, and we'll promptly get back to you.
I want to thank all of our guests again tonight for talking about this
Absolutely.
important topic of traumatic brain injury. To rewatch tonight's episode, check back on our homepage later this week or check your cable provider's schedule for rebroadcast times. Our next live episode is March 19th at 7 p.m. Be sure to tune in. This is Veterans Voices of Contra Costa County signing off, wishing you all a relaxing evening. And for the veterans out there watching tonight, hua and ura, good night.